Namaste. The men in our lives, while tirelessly providing for their family, achieving career milestones, or being a pillar of strength, supporting loved ones through thick and thin, often neglect their own health needs. But now, it's time to rewrite the narrative and encourage them to take care of themselves. Every year, the month of June is commemorated as Men's Health Awareness Month. And to understand men's health issues in detail, we have with us our expert, Dr. Vilvapathy S. Karthikeyan, Microsurgical Andrologist, Men's Health Consultant, and Urologist at Apollo Hospital's Greams Road, Chennai. His valuable insights and advice will delve into various aspects of men's health, including common conditions, its prevention, and early detection, which is the key. Thank you so much for joining us today, Doctor. Let us start by understanding men's health in detail. What are the most common health issues faced by men today?
So, men's health, as we understand, is celebrated in the month of June. That is only because we need to provide an awareness to men. Men have to understand that most of the medical issues are more common in men, they are more severe in men, and also we see the communicable and non communicable diseases like diabetes, hypertension, etc., even the erectile dysfunction, prostate issues, urinary tract infections. All these things are actually more common and little more severe in men.
So, when we talk about semen analysis, what is a normal semen analysis, Doctor?
A normal semen analysis is very important to understand and know because that is the basis of our treatment. So when we see a sugar report, we know the normal values. But semen analysis by itself is a variable test. So multiple parameters can affect the semen analysis. We follow the WHO guidelines and the 6th edition of late which is being used. Here we have a normal semen analysis normogram. So here what we follow is the semen volume, the characteristics on the physical examination of the semen and the microscopy. We have to note that the concentration, the motility and the morphology are very important. So a concentration of 16 million sperms per ml and a rapidly progressive motility, that is a fast moving sperm of more than 30%, and a normal morphology of more than 4% is considered as normal.
So, when we say infertility, what is infertility in men, Doctor?
So infertility can be because of a male or a female factor. Infertility means not able to conceive even after 12 months of unprotected intercourse and following all the principles like having coitus during the fertile period and knowing what is a fertile period, when the woman ovulates. All these things when put together, if after 12 months the couple is not able to conceive, that is called infertility. And here when it is a male factor, it is called male infertility.
We have a lot of our viewers who have asked us about low sperm count and if it is treatable. Could you elaborate about it, Doctor?
So as we discussed about the normal semen analysis reporting, any concentration less than 16 million per ml qualifies as low sperm count, and the low sperm count can be because of multiple reasons. It can be because of say varicocele, a small size testis. It can be because of hormonal issues like a low hormone from the brain or the testosterone, etc. It can simply be because of obesity or some risk factors like exposure to radiation, etc.
So, how do we understand if a person has low sperm count?
So it is not possible to identify by any symptom or sign about a low sperm count, but it is identified only on the semen analysis examination. So as I told, whenever the count is less, that means it is low sperm count. This can be picked up by some men when they see that their testis size is slightly lower, or they feel some heaviness in the scrotum, or they feel some veins enlarged in their testis. These are some pointers towards a low sperm count. The body mass index is also very important. If there is obesity, then think about low sperm count in yourself if there is infertility.
Doctor, you spoke about consummated marriage and um, what are the treatment options available today for an unconsummated marriage?
Today, of late, we are seeing more and more couples presenting with non-consummation of marriage. To understand what is non-consummation is, there has never been a successful penetrative intercourse in this couple. So we are even seeing 15 years of post-marriage, the consummation has not happened. This can be because of a male factor or a female factor. In male factor, it can be a erectile problem, a severe premature ejaculation, or just anxiety about erection itself, which can be the cause for this. When we again see infertility, it is a couple problem. When we see unconsummated marriage, it is again a couple problem. So we also take detailed history and get the wife checked by a reproductive medicine or a gynecology consultant to see if there is a tight vagina.
Moving on, doctor. What is a varicocele and how does it cause infertility?
So, in our andrological practice, varicocele is one of the most common surgically correctable cause for a low sperm count. As we are mentioning the definition of low sperm count, we also need to understand what is varicocele and how a varicocele causes infertility. For that, we need to understand two things. One is why the testis is placed outside the abdomen when compared to the ovaries which are inside the abdomen. So for that the reason is these testes are placed outside so that the core temperature, so the temperature inside the testis is lesser than the core temperature in the human body, and that reduction in temperature is brought about by the arterial and venous system of the testis. So every organ in the body has a blood coming into it and the blood flow going out of it. So here what happens is there is one or two artery which is coming from the heart, and there are multiple veins around the artery which take the blood back to the heart. In varicocele, what happens is these veins are defective. It is very similar to what is called as varicose veins in the legs. So there what happens is the blood is bidirectional. So we all know that the blood should go from the testis to the heart. That is one way direction upwards. But here blood goes up down like that. Therefore the heat dissipation is lost. Therefore there is a higher temperature in the testis, and also the metabolites, that is toxic substances, are not cleared. These things cause damage to the testis. So this is the reason why a varicocele causes infertility, because of low sperm count.
And what are the treatment options available to treat varicocele today, doctor?
Yeah. So as I mentioned, varicocele is a surgical cause. So that is, a surgery is the corrective treatment for varicocele. And whenever we look at surgery, we are able to give a cure. That is, once we remove the veins, it is possible that the varicocele problems can be eliminated to a great extent. That depends upon multiple factors. And regarding the surgical treatment for varicocele, what we do today is the standard of care, that is microsurgical varicocelectomy. We use a operating microscope, which is an instrument which helps us to magnify the vision. We identify only the blood vessels which are big, which are problematic. In this process, we have to safeguard the blood vessel which comes inside, that is the testicular artery, and we use a intraoperative microvascular Doppler. So that is to identify the artery. We also should save the passage which carries the sperms and the lymphatics. So these things are very well done in a microsurgical procedure, and this is the standard of care today followed world over.
Doctor, apart from a general physical examination and understanding the medical history from the patient and a semen analysis, are there any other tests that are prescribed to the patient to help identify the cause of infertility?
Yes. So in this process again we have to understand how the sperm production happens. So for that we get hormones from the brain which act on the testis and produce sperms. These hormones are LH and FSH which come from the brain, and testosterone which come from the testis. In men and women, both the male and the female hormones exist, but the quantity of hormone is obviously, in male it is the testosterone and in female it is the estradiol. In each individual, both these hormones coexist. So an idea about all these hormones plus the physical examination, the scan, etc. will give us an idea about the cause and the extent of damage which has happened and the treatment options.
Doctor, what is azoospermia and how is it treated?
So azoospermia, again we are seeing more and more men today with azoospermia, that is an absent sperm in the semen. So again going back to the basic what we told about semen analysis, the concentration of sperm in 1 ml of semen is less than 16. If it is 16 million, it is normal. If it is less than 16, it is low sperm count. If it is 0, it is called azoospermia. Whenever a man sees a report of azoospermia, immediately what goes on is in his mind is whether I am producing sperm or not. So here we are having two types of azoospermia. One is a obstructive type and second is a non-obstructive type. Here obstruction means some block in the passage which is carrying the sperm from the testis to the semen, and non-obstructive type is where there is no block. So as we can understand, the obstructive type sperms may be normal, but they are not able to find their way into the semen. But in non-obstructive, since the passage is good, the sperm production itself is defective. So the treatment options would include like first investigation, so where we do the hormones which I just mentioned, the LH, FSH, etc. And based on that, we understand what is the treatment available. So in the presence of a block, if we are able to identify the block, we can open the block by microsurgical techniques where we can do a basal epididymal anastomosis. That is a surgical procedure which joins the, or when we remove the block and we join the tubes, that is again a microsurgical procedure done under at least 10 to 12 times magnification. And we also have a surgical sperm retrieval which is mainly in non-obstructive type. In non-obstructive type, the conventional treatment is done. That is done is a testicular sperm aspiration. That is a needle treatment, where it is a small needle which is put into the testis. But if we don't get sperms, that is not the end of the road. We have something called a micro TC, which is again a microsurgical procedure, which is done only by the andrologist. It is the most sophisticated procedure available today, where we open the testis and we identify the sperm containing areas. We take those sperms and then give it to the embryologist to look for sperms.
We have some questions from our viewers, doctor. You had answered this question. My sperm counts are normal. Can I still be infertile?
Yes. Again, we are seeing this condition quite often in our practice. That is because of two reasons. We are getting more complicated patients, and second thing is our understanding about this semen analysis and all those things is on the rise always. We have now newer tests called sperm DNA fragmentation, semen reactive oxygen species, etc., which helps us to identify the internal quality of the sperm. What we are looking in semen analysis is only the outside. We just see the concentration, the motility, etc. But what happens inside? How is the DNA? This is now quantified by the newer tests. We can have a patient with a normal semen analysis to still have problems in these tests, and this could be the reason for a treatment related failure, or even if a normal semen analysis the couple is not able to conceive. This gives us more idea.
Doctor, is male infertility genetic? Could you throw some light on that?
Yes. So it's a very good question, because many patients who come to us, they ask why me. So that why me can be answered by this genetic part. Whenever we take up a patient of azoospermia or a very low sperm count, most likely the cause is genetic. It can be a surgically correctable cause like a varicocele, but other than that, in a very small percentage of people, there is a medically correctable cause like a hypogonadism. Other than this, most likely, if there is a severe sperm problem, it is usually genetic. We are also now seeing men with repeated failures, like a repeated failure with a male problem, can also be genetic.
One more question from our viewer, doctor. I have experienced infection in my semen. Could it be the cause of infertility?
Yes. So, till maybe 4 to 5 years back, everybody was thinking that semen infection may not directly lead to infertility. But now, what we are seeing is, with more and more understanding, as I told, these infections can actually cause an inflammation in the sperm passage that can cause damage to the sperms. Even so, the question which was last recently also was, if a normal semen analysis is there, can I still be infertile? In that patient, if we see a semen infection or pus cells, that could be causing some degree of infertility. So, a semen infection or semen inflammation can cause infertility, but it is usually correctable and modifiable.
Hello, doctor. I have read about male menopause. Is it a myth? If not, can you please explain what is it?
Yes. So the male menopause is also called as the andropause, and there is no better time to discuss about it than the Men's Health Month, because most men think that their sperm production is immortal, the testosterone will be okay. But the thing what we are seeing is, with modernization, with lifestyle changes, obesity, etc., we are seeing testosterone deficiency even at the age of say 35 or 40 years. What happens in menopause is the women stop menstruating, and after some time the hormones drop, and those leads to the problem. Like that in men, whenever the testosterone is reduced, at that time what happens is the protective effects of the testosterone is lost. Therefore, whenever there is a low testosterone, if the man is around say 35 to 40 years, it can be considered as an andropause. But it is reversible. If there is a lifestyle problem, etc., once we reduce our weight or we do some exercise, diet, etc., these things are modifiable.
Hi, doctor. I have read in a medical article about penile fracture. A male reproductive organ is fibrous. Then, how can a fracture occur?
So, as we all know, there are no bones in our penis, but when the penis is erect, it is as hard as a bone because that is when it helps us in penetration. So, when there is a hard structure, when there is an unexpected change in the position, that can lead to a fracture, and that is called penile fracture. And once a penile fracture happens, that erection is suddenly lost. So, yes, it can happen.
I have read that stress is a direct link to erectile issues. How does this happen, doctor? Can you please elaborate?
So, in the modern world, stress is the factor for most of the non communicable and the health related issues. So, again, we need to understand the basic physiology of an erection. So, whenever the mind is cool and calm, there are signals which come from the brain to the penis through the spinal cord, and that is how an erection happens. So, now we could understand that whenever there is a like the mental frame of mind is not clear, if the stress is because of something else and that is constantly in the mind of the man, then that itself can lead to a erectile problem because the signals don't reach the penis, and the brain thinks that yes, this man is stressed now, this is not the time for this sexual activity, therefore probably the mind doesn't send the right signal to the penis. So stress can cause also problems like sperm issues, hormonal problems. Stress can reduce sleep, and all these things can have a vicious cycle to cause erectile dysfunction.
Doctor, as we mentioned, June is commemorated as Men's Health Awareness Month. So, what would be your advice to our viewers today? And what are some of the best practices for men to keep themselves healthy?
Yes. The main idea or the theme for Men's Health Month is just to make men aware that they are not invincible. They also have to take care of themselves. Some health checkup is very important for them, especially when they turn 40. But again, we are seeing more and more men who come in their 30s and 35s too with problems. So it seems that age is not a bar for problems. So we need to take care of our own health, follow good diet practices, have a good sleep, have exercise and physical activity in their routine, and reduce stress and anxiety because stress and anxiety don't lead us to anywhere, they give only problems. Therefore, it is time to be mindful about these things and take our health forward. And that is the most important message which we like to give on this Men's Health Month.
Thank you very much, Doctor, for elaborating us on how we can keep our men healthy.
Yes. Thank you so much.
For appointments with Dr. Vilvapathy S. Karthikeyan, Microsurgical Andrologist, Men's Health Consultant and Urologist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat 044 4040 1066. Thank you very much, Doctor, for joining in this FB Live session. Thank you, viewers.